The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, cosmetic dentist Dr. Guy Lewis gives his patient renewed confidence with her new smile. Interventional cardiologist Dr. Annie Varghese describes the symptoms of a heart murmur. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
So Mr. Lockhart, he was without symptoms, but went to his primary care doctor just for a checkup, and his primary care listened to his heart. On listening to the heart, he heard a murmur. A murmur is a noise, a flow across something, and this was across a valve, actually. He was sent for an echo, and the echocardiogram showed that he had severe stenosis, or thickening of the aortic valve, which is the valve that leads the blood from the heart to the rest of the body.
When I went in for a checkup, we found out that I needed a three-way bypass, and the aortic valve had severe stenosis. And I guess that's something that I have had all my life. And I had no pain to indicate I had a problem.
Well, that means severe can become critical and people can die suddenly without any symptoms. Immediately I sent him for further evaluation with the surgeon. So he was really saved by a primary care doctor listening to his valve, listening for that murmur.
And I couldn't have been happier with the results that's been achieved thus far. I feel like I'm good for another 40 years maybe, and be one of those people from biblical days.
The heart can accommodate over time. Now, if something happens acutely, people will be symptomatic. They may be short of breath, they might have chest pain, because something happened. But if something is slowly encroaching on blood flow, there may be no symptoms. 50% of patients who have coronary disease come in with sudden death, they're dead, and we may or may not be able to save them. So this is another reason why, really after age 40, it's so important to have preventative testing, evaluation, treatment, and this is what I encourage to all my colleagues and myself to do that on a daily basis.
We came to the right place, got the right doctor, and I think it's all because of Dr. Varghese and what she had a hand in, and I'm very grateful, and I'm here. You can't beat that.
Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells.
I was in a major car accident that seriously damaged the midsection of my foot, and providers were not able to repair it. So because of that, I was put in a brace to help me to walk and to do the things that I needed to do. I wasn't able to play with my kids. I was very active before, and so not being able to play with my kids really hurt me.
Post-traumatic arthritis specifically describes joint pain after damage to the joint. So anytime if you break a bone or break a bone through cartilage, if that cartilage remodels, you will get arthritis in that joint. If you break a toe and it goes through cartilage, you will get arthritis in your toes. Sometimes you fracture your ankle or you fracture your foot in multiple places, and that can lead to some very serious post-traumatic arthritis.
She came into the room and she goes, "We can fix you." And I'm like, "Really? You mean I can walk again?" And she goes, "Yeah." And I said, well, will I have to use a cane after the surgery? And she goes, "No." And will I be able to run? yes, you'll be back to normal. You can do everything that you used to do prior to the accident. And that meant a lot to me, because the one thing I wanted to do was to play with my kids again.
Told her that her answers were not easy. The answers would be to fuse her entire midfoot, and on one part of her midfoot actually using implants to help restore the joints. The surgery was long and intense, but we fused the midfoot, the implants went in beautifully, and her recovery has just been wonderful to watch.
My life is back. I can walk, I can run. It's not pretty, but I can run. I can do everything again that I was not able to do beforehand. And so she has given me back my life, and I am so very grateful for that.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Find your doctor on bestdocsnetwork.com.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up. And then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile, you know. And once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, and she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone. And after I feel like I can take on the world, I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
John has a question for Dr. C.T. Wynn. Is it bad to breathe out of my mouth?
Yes, mouth breathing can be harmful to your health. Mouth breathing can cause tiredness, lack of concentration, snoring, dental problem, and it can also depress your immune system. Please consult your ear, nose, and throat specialist for a solution.
Ask our doctors on bestdocsnetwork.com.
You hear a lot about sleep apnea. Well, sleep apnea is different than snoring. Snoring is just when you make a lot of noise, but your oxygen levels don't fall to dangerous levels. Sleep apnea is when your oxygen levels do fall because not only do you snore, but you gasp. Basically, you snore so bad or your airway closes so much that your oxygen level goes down and your body therefore raises you up into a lighter level of sleep so that you don't die from that low oxygen level. That's when you chortle or gasp and you start breathing well again. Sleep apnea is a bad disease. It happens a lot in obese people, people with thick necks, and it can result in a far higher frequency of auto accidents. It can result in hypertension, low testosterone levels, depression, and we think even certain cancers. Now, how can you tell if you have sleep apnea? Well, ask your bed partner if you gasp. That would be suggestive. Ask your bed partner if your snoring is worse and worse. And you can get a little finger test done by your physician where you wear a little monitor on your finger overnight and see where your oxygen levels go throughout the night. If your oxygen levels go low, that's sleep apnea.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through the multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery. So we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Coming up on the second half of today's show, facial plastic surgeon Dr. Yadro Duchik helps his patient improve her appearance and quality of life with a facelift. Vein specialist Dr. Peter Morgan discusses wounds that won't heal caused by venous insufficiency. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. As well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site, or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Request an appointment on bestdocsnetwork.com.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area. Our bodies need at least 90 milligrams of vitamin C each day. The best way to get your vitamin C is making sure you eat at least 5 servings of fruits and vegetables every day.
Well, I had some reoccurring wounds on my legs that just wouldn't heal. It seemed to be worse in the wintertime. Well, I had them probably on and off for a couple of years, but it seemed to have gotten worse in the end of 2011.
Many of the patients that we see that have wounds have had them for many years. On several occasions, we've seen patients that have had wounds more than 20 years. They typically are getting seen at wound care centers or getting treated by a variety of other healthcare providers without success. These wounds occur on the legs. They are frequently very painful. They are not associated with diabetes, which is a common misnomer. They're caused by venous insufficiency or varicose veins.
I had gone to a local hospital, to a wound center, and spent about a month there doing different things, going back every week, and it was no different. And I decided I was just wasting my money there, so.
He came in, we performed a venous Doppler ultrasound on him, diagnosed venous insufficiency. We corrected that venous insufficiency on him using endovenous radiofrequency ablation of the vessels, and all his wounds healed up very promptly, less than 2 months. In fact, some of them were healed within a couple of weeks.
You know, he seemed to have a little bit, better idea what it was. It was a circulation issue as far as the veins, and he talked to me about the different veins that they could do as far as the closing off of things, and I was all for it. He said that, he thought it would heal up within, no time, and he was correct.
Treating those veins results in relatively rapid resolution or healing of the wounds. Probably the #1 reason why I began to specialize in the treatment of venous insufficiency was that I discovered that it was the solution to these chronic wounds that had previously not been treatable.
Seeing Dr. Morgan, he was very personable. He's easy to trust right off the bat, knew what he was talking about, very friendly staff. Like I said, I've never had any issues since, and I've been very happy with the experience.
Cindy has a question for Dr. Jeffrey Catarini. Can you tell me if a brain tumor is benign or malignant?
When a patient comes into the office, we can tell the vast majority of time by looking at the CT and the MRI whether a brain tumor is malignant or benign, meaning cancerous or non-cancerous. We know if a brain tumor is malignant or cancerous or benign or non-cancerous, usually by its location, enhancement pattern, size, and other surrounding structure effacement in terms of edema or swelling.
Ask our doctors on bestdocsnetwork.com.
Nuts are not only a source of healthful fats and protein, they also are a massive dose of omega-3 fatty acids that can help boost your brain power.
In terms of pediatric urologists, there are only about 350 of us in the entire country, so it's a very subspecialized field. Even though there aren't very many of us in the country, the services that we provide are very common problems that children encounter, and so we needed a place to work where we could provide good care for patients of all the various ages, and this was a place that allowed us to do that.
So Dr. Bush and I are very excited to bring pediatric urology to the Kids Surgical Institute here at Forest Park in Frisco. Pediatric urology is an integral part of any pediatric care system, and we're excited that this is developing here in Frisco to meet an obvious need in the community in North Texas.
Here at Forest Park, one of the unique opportunities that it made for us was having such an expertise in pediatrics, so that we felt very comfortable bringing our team with our anesthesiologist and our team approach here. We knew that our children would get excellent care, but it also allows a comfortable environment for the teenagers and the adult patients that we have to also be taken care of at the same setting, which we couldn't accomplish at many of the other hospitals that we have affiliations with. So that's something that's very unique and specific to Forest Park.
Between my partner and I and anesthesia, we also have the other ancillary services in the hospital that we need just to help take care of children, other specialists that are here. So we feel this will be an outstanding environment to continue the work that we do.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as a unique individual.
I am getting older, and teaching is my third career. And what I observed was the older looking teachers were losing their jobs. And I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Duchik and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that You have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Watch more videos on bestdocsnetwork.com.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The breast center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If the patient comes in with a palpable lump, we want to find out what it is. It doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes a torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The breast center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone, because we're going to walk it with you.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.